The Trial of Excellence in Southern Africa (TESA) is a network funded by the European and Developing Countries Clinical Trials Partnership (EDCTP) to support capacity building and research across Africa. With over 2.4 million euros invested in countries like Botswana through TESA grants, it has become critically important for African nations to harness collaborative strength to mobilize resources and advance the continent's research agenda.
We have had withdrawal or termination of some of the funding streams from the United States government and the National Institutes of Health, which are threatening the research that we have been undertaking in the various sub-Saharan countries or even globally. And therefore, with that gap, it means we have to look elsewhere to ensure that all the other peasants or other countries that have got the capacities also strengthen and invest in research, including our own country.
Through the TESA network, Botswana has significantly enhanced its capacity to train local scientists, enabling them to define the research landscape and contribute to locally driven innovations.
Their work has been very impactful in terms of informing guidelines, in terms of, as you might heard this morning, one of them developed a new assay. So that assay is going to be used in country to validate it, to be able to access to individuals who may be failing antiretroviral therapy. So that's an innovation. So we expect that innovation, we are incubating innovators who will be able to take some of their innovations into IP.
Several TESA beneficiaries from across the continent shared insights into their research projects and offered recommendations aimed at strengthening public health systems in Africa.
We have done very well with HIV management, but it's because of this that we may likely have an issue with hepatitis B virus, because we need to really do HPV testing. It is there in the guidelines, but I would just call that the implementation on the ground be prioritized. And so because of this, we really caution against the use of lamivudine as the only HPV active drug among individuals that are HPV and HIV co-infected.
So what we did is we had the 4 strains, and on each strain we picked the 3 epitopes and used those to come up with the epitopes for our vaccine. And from these 7 clusters of 14 HTL epitopes were joined using linkers, and we added an adjuvant. An adjuvant is usually added in vaccine designs because it's known to enhance immunogenicity.
Although Botswana is a member of TESA, the country is still in its early stages of joining the EDCTP association, which will further integrate it into global research and development initiatives.